Hello, my name is Subramanian. I'm a third-year undergraduate at UC Berkeley. This research was done in collaboration with the IGOT Institute at UCSF, and I'll be talking about the sign fin nail, a new innovation for femur fixation in low and middle income countries. Background on trauma in low and middle income countries is a leading factor of disability, and femoral fractures are the most common, often due to road traffic accidents. Sign Fracture Care is a nonprofit headquartered in Washington State, Richland, Washington, that provides implants and training for free to surgeons in low and middle income countries. Typically, orthopedic fixation with an intramedullary nail means that you have inserted the nail into a long bone and you put screws on either side of the fracture. As you can see here, the fracture is here and screws on either side. However, the sign fin nail only has screws on one side, meaning that it can be a quicker surgery, it is easier to train on, and costs less. However, putting screws only on one side may have concerns over how well it may treat fractures in terms of fixation. For our study, we used the SIGN database, which is a registry of 180,000 unique fractures. It included adult femoral fractures with follow-up past 6 months. The primary outcomes we used were X-ray healing and full painless weight bearing. After all of our inclusion and exclusion criteria, we ended up with nearly 3,000 fractures. We started off with nearly 100,000, but after exclusion criteria, we got to nearly 20,000 fractures that met those criteria. Of those fractures, 85% were lost to follow-up, meaning that they didn't achieve 6 months of follow-up. Identified confounders were controlled for using something called an inverse probability of treatment weighting, meaning that we would weight each case based on a statistical method to make sure that the confounders didn't affect our results. As for results, the relative risk of X-ray healing and painless weight bearing were no different between the standard and the fin nail, but the fin nail surgeries were 25 minutes shorter. All of these were significant results. In terms of strengths and limitations, we did have a large population, but the study was observational and used a database. There was a low follow-up rate, and there could be unmeasured confounding, though we tried to control for some measured confounding that we could see. In conclusion, the SIGN fin nail provides comparable healing to the SIGN standard nail, which has been established to provide good healing, while conferring many benefits regarding cost, time, and ease of use.